This is Dr. Visma here. We are going to start a surgery for endometriosis. I will just briefly describe the case. You can see she is a patient with dysmenorrhea and having since 1 to 2 years. She is a young patient. You can see the right tube. Okay, the right tube is kinked here and it is attached to the uterus. Okay, we will try to separate it, and I think we won't be requiring a salpingectomy here. You can see this superficial endometriosis here. These are all superficial vesicles. Okay, you can just go. Okay, you can just excise this, or you can just burn this off, does not matter. Okay, but this vesicle suggests that it's a quite a active disease. Okay, and you can see the POD is free, but there are some little adhesions here at the uterosacral ligament, both the sides. So you can see this nodule here. Okay, this is the peritoneal is kinked here on the right side and also on the left side. Okay, so now we will come back a bit. Okay, and you can see the sigmoid is going here and it is adherent here. Okay, so we all know the first step of doing, we will start from sigmoid mobilization. Okay, now when there is, we can see the serosa is very close here on the lateral pelvic wall. So what you can do is you can go, you can stretch and you can just hold this part. Okay, no need to touch the serosa. Okay, and you pull the serosa here. Sorry, you pull the fat here. Now you can see there is a difference, this and this. You just go in that line. Okay, okay, you don't need to. I think there is a small smudge on the camera. We will just clean off the camera once I do this additional. So you can see now this plane, clear plane here. Okay, stick to here, stick to this plane. Okay, okay, you can okay, you just go here. Okay, you remove this adhesion here. Okay, and there you go. Okay, okay, so Rasik is assisting me for this case. You can hold this is the IP ligament here. Okay, so now I can now just be parallel to the IP ligament. Rasik, come a bit, thoda पीछे आ जा. हाँ, okay. Okay, okay, try to mobilize this. Yes, so now you can see I am gone retroperitoneum and actually you can see the urethra, but I would like to mobilize this a bit more. Okay, okay, actually I am in the retroperitoneum. Okay, but it's fine as long as you mobilize the rectum. Sorry, the sigmoid here. थोड़ा है ना पीछे से दिखा सकता है थोड़ा. हाँ, समझ में थोड़ा. Yes, you go, you create this space through blunt and sharp dissection both. Okay, जैसे कि बता यहाँ पर इंस्ट्रूमेंट मत दिखा. Yes, okay, go this side. Yes, this much is enough for this. Yeah, again come back. Okay, okay, so now this adhesion is completely gone here. Yeah, I think you can clean the camera a bit. I think there's no gas inside. Guys, there's no gas inside. we are working out a solution here. There's no gas inside the abdomen. Just a minute. I think that switched off the... Okay, we are back with the gas. I think it has been dissolved. Okay. Okay, now we can see the ureter here. Okay, I will just hold this peritoneum. You can continue the live, yeah? Love kush, that's not a problem. Okay, I think the issue has been resolved. Okay, you go here. Okay, you lift and here you can see. Okay, this is the ureter. You just keep a small neck here. Okay, just give a small neck, yeah, and you are now in the plane of the ureter. Okay, so this is the ureter here. Always anterior dissection, as we know, yeah. You go to the ureter, okay, you open up your instrument and there you will get a plane, okay, and you cut, again go, create a plane, okay, advance your instrument and cut. Okay, there will be some fibers of the ureter which will be very much, yes, you can see these vessels surrounding the ureter. This is the adventitia of the ureter. Okay, try to preserve. In a case where there is not much endometriosis and there is only a superficial peritoneal endometriosis, try to preserve this adventitia. Okay, you can see. So this advent, you can just go with very blunt kind of a dissection. Okay, you can see this. Okay, try to preserve. Okay, okay, now रसिक थोड़ा आगे आ सकता है तू. Go further. Okay, yes. Okay, yeah. Now you can थोड़ा पीछे आ जा. तेरा अपने को ट्रैक्शन बदलना है तेरा. Okay, yes. हाँ, ओवरी को पकड़ सकता है. Yes, very good. Okay, now it is clearly visible, okay, that the ureter is quite lateral. Okay, ureter is going there. We don't need to go further. Okay, we'll just pull the peritoneum, the broad ligament which is on the medial side here. Okay, and we'll just start to open this up. Okay, so this is in the previous live surgery which we did today. So this is called opening up of the pararectal space. Okay, so this we are opening. Okay, you can see the pararectal space opening here. Okay, yeah, so now we have lateralized the ureter further. This is the peritoneal fold, but now we are dealing with this tube. Okay, just need, okay, you can see there is this small king sort of thing. Okay, you open it up and you can see there is active endometriosis here. No, that's it. Okay, try to release of these adhesions here. Okay, and you can see the tube is normal here. The tube has been released, but you can see the small endometriotic spots here. This, okay, we will test the tube, of course, but the tube is not looking very healthy. It is a bit kinked. Okay, and you can see the kink here. You can see because of this endometriosis there is this small kink here. Okay, right now we are not going to do much about it. Okay, we'll first concentrate on the peritoneal thing, and we will test the tube. If the tubes are open, we won't be doing anything right for now. Okay, now what Rasik can do, you can come Rasik and just lift it up like this. Just a minute. Tanvi, and hold the instrument. The other way you can do is, you can just open your instrument like this, okay, and go like this, okay, just keep it like this. Yeah, so now you can see this band of adhesion, this. Now there are two things to be, so we know the ureter is going like this, and we have also separated, this is the intestine here, okay. So you can safely go here. Yeah, you can cut this peritoneum, okay, cut and dissect, cut and dissect, okay, cut and dissect. Again I will once more have a look at the ureter. Okay, ureter is quite lateral. Okay, I can safely go and remove this peritoneum. Okay, you can see I am pulling the peritoneum cranially. Yeah, okay, be careful of any important structures. This is the pararectal space. Okay, okay, you put a nick, okay, and gently dissect the spaces. Okay, now I can safely remove this whole peritoneum. Okay, now I am in the pararectal space here. Okay, okay, you can just park it here. Okay, uterosacral looks okay. Okay, but we'll just can see the fibrosis here. To be very careful here. There sometimes you may be very close to the veins here. Yeah, you can see the vein here. Yeah, this is the fibrosis we need to remove. Okay, we will remove this fibrosis now. Okay, this was the left uterosacral nodule which was already diagnosed, and okay, this is the uterosacral part of it. This is the uterus part of it. Just beware of the rectum there. You can safely park it here now for now. Okay. There's a small fibroid actually there. Rasik, fibroid. Oh, I think. Okay, remove the fibroid. Okay, now we can see the ureter is down. Okay, it's not in our track, and we can safely go for a adhesiolysis here. Okay, now for adhesiolysis, na, come up. Okay, very good. Okay, so what you can do, you can see the traction given by my assistant. Okay, he's pulling towards the left. Okay, now the ureter, the rectum, everything is free. You can just go, okay, and cut here. Okay, this is all endometriosis here. Okay, you go inside and you push. Yes, so now we have the ovary which is a lot free. Don't need to cut this. Okay, this is the ovarian ligament here. Okay, you can go here. We can cut this nodule. Okay, stick close to the nodule. No need to go and shave off the cervix. Okay, I think we can remove this nodule. Okay, so the left part is done. Okay, I think here se idhar aaja beta. Okay, this is the cyst here. Okay, which can be tackled later. Okay, once I will have a look at the ureter again. Okay, so what we can do here, okay, we can safeguard the ureter. Okay, yes. Okay, we have created a plane here. Okay, so the ureter is going down. Okay, and we can just safely cut here. Okay, so now there is this free space. Okay, this is the uterine here. Okay, and you can release the ovary from this peritoneum here. This. This is the uterine branch here. Okay. This is the normal peritoneum here. Okay, you can see the vesicular endometriosis here. Okay, we will leave the cystectomy for the later part. Release. Okay, So now it has been done from one side. Okay, now we'll come to the right side here. Let's see. Yeah, so here you can see that the ureter is going like this. Okay, but then here there is medialization of the ureter here. Okay, so we need to do a ureterolysis and first clear of the ureter. Just hold this, there is no need to, you come with the camera behind. Okay, so you can see the ureter here. Okay, you can just go here and just put a small nick here. Open up your instrument and you can see I am following the path of the ureter here. Again the same technique which we followed for the left. Go to the ureter, stay above it. Okay, dissect anteriorly, create a plane. Okay, and go on cutting the peritoneum. Okay, now what I have done, I put my instrument between the ureter and the peritoneum. Okay, I can just go and cut. Yeah, so now this ureter has lateralized. Okay, if you want you can just go a bit more. Okay, okay, so now what this does, so you have this free peritoneum now. तन्वी ये थोड़ा ढीला हो गया, देख लेना एक बार. So now I will lateralize the ureter here. Okay, the ureter has gone and it is lateralized. So now I can release this peritoneum. Okay, before you seen the due to the peritoneum the ureter was going like this. So now because I have released the peritoneum, the pull is gone. Okay, and you can see the structures very nicely. Okay, yeah. Okay, so now, yeah, so this adhesion is there, na? Here, yeah. So what I can do is can release this adhesion. Okay, रसिक थोड़ा तेरा ट्रैक्शन है ना, इधर आजा, छोड़ दे उसको, छोड़ दे, तेरा ट्रैक्शन गलत आ रहा है. हाँ, कर ऊपर ऊपर. Yes, okay. Now we can very well see. Yeah. Now this is a nice traction. Okay. I have released this adhesion from here. Okay, this one. Yeah, and now I can come back a bit. Okay, yeah, and we can just try to remove this peritoneum off. Okay, okay, okay. So now before that, give me a section. Before removing that peritoneum, I can see there is this yellowish fat. Okay, so that means the bowel is somewhere here. Yeah, so what to be done? Yeah, so now come back, Rasik. Yes, तेरा ट्रैक्शन मत बदल, ट्रैक्शन वैसे का वैसे रख. Okay, so now what I can do is, okay, I can go here, can go laterally, and I will just open up this. Okay, one layer medial. Okay, now I can just go like this here. Okay, and create a plane here. This is the pararectal space, this one. So this is the space here, okay. Now I am in the Denonville's fascia here. कैन कम, पीछे आ जा, तेरा ट्रैक्शन बदलना है, ट्रैक्शन बदलना है। तन्वी तो ऊपर कर रही है यूट्रस को। This is the vagina. Okay, so can go here. Now this is the correct plane, okay, gone, and we have separated the ऐसे थोड़ा पीछे आ जा। Okay, you go, you dissect, okay, so the rectum dissection is done. Okay, you can see the rectum, and now as I know that the rectum is quite far away, okay, I can just go and remove this peritoneum. Now once this has been done, रसिक अभी fallopian tube पे वापस, okay, can be bipolar मिल सकता है। I would like to switch my grip to a bipolar. Okay, it's an atraumatic instrument. There's some bleeding there. So this is the addition of the tube here. Okay, slowly, steadily, we try to release all these additions here. Yeah. And now for the main. Okay, just hold it here. तन्वी कर यूट्रस अब थोड़ा. हाँ कर रहा है. रसिक तेरा भी डायरेक्शन देखो, यहाँ पर आ जा. ओके this adhesion has been released here. Okay, you can see it's quite free. No need to go further. Okay, it has been released from everywhere. You can see the uterus going. Yeah, now comes the important part. Okay, वहाँ से छोड़ दे रसी. ओवरी को पकड़ ले. हाँ पकड़. यस यस बस. नहीं पकड़ रहा है बाइपोलर. इंस्ट्रूमेंट है ये नहीं बाइपोलर ಇದೆ. I think the tube is now released. I don't need to go much more. तन्वी बीच का ट्रोकर थोड़ा निकालेगी प्लीज. Okay. हाँ. Now we can go for the tube test here. Okay, Tanvi. हाँ कर. Okay, so we have done the methylene blue test, okay, but tubes are not, there's no spill in both tubes. Okay. Okay, the tubes are blocked for now. This has happened because of the kinking, long time kinking, okay. So the tubes otherwise look healthy, there is no hydrosalpinx in them. So in my opinion we can actually wait and just do this test a bit later, or we can also do it sometime else. Yeah, we will just remove the left cyst. That's it, left cyst पे आ जाना. पकड़ इसको. छोड़ दो उसको. होल्ड, लेफ्ट ओवरी को होल्ड कर. I think there is no other cyst visible. Yeah, we can just, yeah, it's fine. Ovary looks fine. Okay, no, just to skip the traction as it is. So once you have a look at the completion part of it, okay, it's bleeding from here. Just I will just coagulate. Okay, you can see here. रस्सी नीचे बताने का है. Okay, you can see there is some oozing from somewhere. I think this is the spot. Give me a section. Whenever you are coagulating near the ureter, okay, just keep one, when you are using especially the shearer, okay, just keep one instrument. हाँ, now I know where it is. इसी तरह ट्रैक्शन थोड़ा बदल गया. चलेगा. हाँ वही सर, बट आई कांट सी एक्चुअली. कैमरा साफ कर. Yeah, so what I'm doing is, I think the traction which Rasik is giving, it's not appropriate. I can't see it. So what I will do, I will shift the traction to myself. I will just lift the ovary and it can be seen. Okay. Instrument दे दे. हाँ वो है. तन्वी तू अब करेगी ना तो बहुत बेटर. या नहीं मैं सर यूरेटर देख रहा हूँ और कुछ नहीं. एक्चुअली ये है ये. अभी क्या है सर, ये यूरेटर इज डाउन ना, सो आई एम नाउ आई कैन लाइक, अगर कुछ ब्लीडिंग होता है तो अभी मेरे को डर नहीं है, यूरेटर इज फार अवे. ओके, छोड़ दो वहाँ से. ओके, which side? Yeah, I want to check it. हाँ सर, yeah. हाँ, you can hold and lift it up. Yes, thank you. I know that, and thank you. Okay. Everything seems to be okay. Radiation is released off. यहाँ पर एक है तन्वी, you can show me your ये छोड़ दे वैसे क्लोज. Thank you. Can show me your instrument? Is it here? This na? Okay, so there is this small patch of adenomyosis, very small. Okay, we can just do a microablation there. Yeah, the probe is ready. Yeah, and just Tanvi, final we will have a check of the tubes after doing the microablation. There's some bleeding there from, actually it's from where I had held the ovary. It's okay. Okay sir? Suction, I will take the suction. क्या हुआ? हाँ वो इट्स पेरिटोनियम वहाँ का. चलो माइक्रोएब्लेशन. सर वन प्लेस, जस्ट द सेंटर जो है ना सर वहाँ पर. नहीं